Okay, let's move on. And Dr. Cole, our next topic is going to be percussion therapy. And boy, I tell you what, Doc, I wish this was around when I was playing baseball and basketball in high school, and then later on in my 20s and 30s, 16 in softball and touch football, because, it seemed like the older you get, the little pain and things come through, and the nagging stuff. And although, let me say that percussion therapy has really helped my surgically repaired shoulder, the surgery that you did on me back in February of 2019, and I pretty much do it nightly. With this percussion therapy device that I have, and we're going to have our next guest is one of the gentlemen who invented it. But what's your thoughts, first of all, Dr. Cole, on percussion massage therapy and devices?
I'm a believer. I think there's some interesting evidence, Steve, that shows that these electronic percussive devices can help with pre-workout mobilization, increasing blood flow, tendon stretch, and so forth, and also for recovery. So there's some data that shows that it might increase range of motion, it might promote blood circulation, can relieve sore muscles, and as I mentioned, it can sort of accelerate warm-up and recovery. So it makes sense when you start to understand some of the science. It's not ridiculous in terms of a patient actually acquiring these on their own. I know a lot of therapists will use it, some chiropractors will use it as treatment, but you can actually own these devices. You can buy them, and they're reasonably priced. So I think it's just one other modality to help us as we stay active and try to continue to minimize the sort of the aftermath of the workouts we do.
Yeah, I was introduced to it during my physical therapy sessions for my shoulder following your surgery. So that's what I was introduced to it, and I was swearing by it from day one. Well, let's bring on our guest. He's Dr. Warren Bruhl, the CEO of Percussion Fitness and co-developer of the BUFFENUFF Power Massager. He's also executive director of several charitable organizations doing sports education, healthcare work internationally. Prior to leaving full-time practice in 2011 to pursue charity work and other business interests, Dr. Bruhl had one of the most successful pediatric and family chiropractic practices in the United States. So, Dr. Bruhl, thanks so much for joining us here on Sports Medicine Weekly.
Great to be here with you guys, finally. Yeah, it's been a long time coming, but, yeah, I'd love to talk about percussion therapy. So, yeah, absolutely. Let's do it.
It's interesting. I looked at your device because it's sometimes hard to distinguish. There's a number of them on the market. And when I look at yours, it almost looks like a like a waxer, like a wax on, wax off, which I guess you call it a BUFFENUFF. Is that the name of your device that you're involved with?
Yeah, Dr. Cole, we call it the BUFFENUFF Power Massager. I mean, it's kind of a clever name, but the idea is that it's an oscillatory percussion massager, and that pad, it oscillates in a rotary, not a full rotary motion, but an oscillating motion. And therefore, you get a lot more surface area contact by using that on the tissue and the body versus the reciprocating ones, which we're going to talk about the differences in them in a few moments, I know.
Well, Dr. Bruhl, you developed the BUFFENUFF Power Massager. It's being used around the world by doctors, therapists, you guys mentioned, athletes, also the elderly, even folks with Parkinson's. Why is it so helpful for so many different people?
Well, I think the thing that you've experienced yourself, Steve, I mean, I know you were getting therapy, I think, physical therapy, and you recognize that, first of all, it helped relieve your pain. I mean, the minute you put that on your body, it starts to take your brain's attention away from the pain that you're experiencing, starts to put its attention on that oscillatory motion. But it's also improving the circulation and helping the mobility. And, we always say it's about being fit, flexible, and ready. And you can stretch injured tissue when you're using that and help to improve that recovery, especially with a shoulder surgery. There's scar tissue and adhesions that can form. And by using that oscillatory percussion massage, you're really speeding the rate of recovery, and you're helping people feel better so they're not in that protective mode, after when they have pain or an injury.
Does this sort of spin forward? Does it spin and does it go forward backwards as opposed to some of the other devices which have sort of a piston type, mechanism?
Yeah, this is just oscillating, Dr. Cole. And then if you turn it on the side, we call that an edge contact. So there's three ways to apply it: either flat on the body, on the tilt, kind of tilted, or on the edge. So when it's on the edge, it's actually creating reciprocating motion, whereas the ones that most people are using, they look sort of like a little mini jackhammer. And you put different heads or balls and things like that on them. But they can't be used often on bony surfaces. So that's where we really get a problem. Let's say you have somebody who had a knee problem. Well, you can't use that over the patella. And you got to be pretty careful around the tibia. And certainly anybody who's had a major hip issue, a hip operation, my wife had a hip operation, we were able to use this somewhat near that location, whereas there's no way we would be able to use the reciprocating device because it kind of is a jackhammer. It almost pummels the body a little bit, which has uses. Both tools are very valuable, but this is the way we prescribe it. We call it nice, mean, nice. Start off with the nice tool that feels good. That's the BUFFENUFF. Put the pummeling tool in the middle, and then finish with the nice tool. You always want to leave people with a good feeling. So they both have value.
Again, we're visiting with Dr. Warren Bruhl, CEO of Percussion Fitness and co-developer of the BUFFENUFF Power Massager. I'm Steve Cashel with Dr. Brian Coe. You're listening to Sports Medicine Weekly. Our website is sportsmedicineweekly.com. So you were talking, Dr. Bruhl, about the two types of percussion massage, and why is oscillatory massage more beneficial and more comfortable for people?
Well, I mean, it starts off with just if you look at the massager there, just the softness of the pad versus the application of the reciprocating tool. And we found that people with Parkinson's, for example, with the tremors and the frailty that they have, when they have that tool applied to it, it can steady those tremors to some degree, and it's being used in some different programs around the country to help people with Parkinson's in their other work that they're doing with the rehab. Petite women, elderly, but also the big burly athlete can use it, and they like it on the edge, on the side, but it has more applications. You can even use it on your head. If you put a towel over the top of your head and you do a massage with that tool, it feels amazing on your head. So it just has more universal application for people than the other tools, but I personally, in my personal practice, I use both of them, but this is more of the go-to on a regular basis.
Yeah, I would tell you, I would not, the ones that are sort of the piston type ones, I would not want to put that on my head. I mean, even if you're using it on your back and you put it to the center of your spine, you just don't want it near a bony surface. So let me ask you a final question. I know,
yeah, go ahead, Dr.
I went to your website, and it looks like you've done some philanthropic work in Africa. I don't know if you've actually gone. I was in Kenya a couple of years ago, did some mission work. We started a sports medicine program in a small village just west of Nairobi. And it was a great experience. Now, obviously, there's a lot of poverty and there's a lot of need there. Did you go there? Have you been there on a mission trip? Are you donating devices there, and how are they actually using them?
Yeah, I go there quite a bit. My parents are missionaries there. We have a school there, and we're building a hospital in near Kilimanjaro. And I've been there 14 times in the last 8 years. Yeah, we donate a portion of our profits to help buy these for people in under-resourced communities, because I got kind of frustrated with not being able to help people that are living in agrarian areas with body pain. They just suffer so much, and I can teach people how to use this tool pretty quickly and easily. So we donate them to churches and clinics and schools, and people really benefit from it tremendously. And that was part of the reason I started the company, was that component of it, because I told my partners I wouldn't get involved unless we weren't doing things for people around the world. I've been very blessed in my life, and I'm sure you have too as well. You get to a point in your life where when is enough? Now it's ready to give back and do for other people. So, yeah, it's a big part of what we do.
Absolutely. All right, so, Doc, we appreciate you being on. Again, Dr. Warren Bruhl, CEO of Percussion Fitness. What I love is, again, I was introduced to it during my physical therapy session. And it's great that people are able to buy these themselves because, again, I use it almost nightly. I actually have one of my sons, my 13-year-old or my 16-year-old, kind of do it for 10, 15 minutes on my back in places I can't reach. And again, I swear by it. Where can people reach you and find out more and get one of these?
Yeah, it's pretty simple. They can just go to percussionfitness.com. They can buy them online. Great gift for the holidays. We have affiliate programs. We have retail opportunities. We have a lot of doctors and therapists that get them. And I recommend if they're going to get one, get the value package. It has an extra battery. And then when the battery is exhausted, you have a fresh battery, you just plug it in. And they charge very quickly. And as you're finding out, self-care or other family members, your son is healing you, which is kind of cool, isn't it? Your son gets to help his dad. So,
yeah, he enjoys it, actually. It's cool. They do. They're like, all right, Dad, let's go. Time for the massage, and they kind of like to work the tool, so it's kind of cool.
Yeah, it is. It is, absolutely. So that's another benefit I notice with the work I do abroad. People enjoy helping other people, and they get to see somebody smile and feel good. There's something really powerful about that. So that was a side note when I developed this tool that I didn't recognize was going to happen. So I'm glad you're enjoying using it, Steve. It's a pleasure having you as one of our customers, and I'm glad you got introduced through your physical therapy and you're enjoying it. And Dr. Cole, nice to meet you through this. And
likewise, Warren.
Hopefully one day we get to meet in person.
I'd love to
Africa again.
I'd love to share some Africa stories with you offline. Just a
absolutely.
Great cause.
Yeah, so you guys have a good rest of your show. I know you got other things to talk about, but thanks for the time today. Appreciate it.
You got it. Dr. Warren Bruhl, again, CEO of Percussion Fitness and co-developer of the BUFFENUFF Power Massager. Steve Cashel here with Dr. Brian Cole. Time for a break. When we come back, it's our Ask the Doctor segment. Got a couple of really good questions from our listeners again this week. So stay with us. You're listening to Sports Medicine Weekly, only on
670 The Score.